Human skeletal system. In this video we will discuss about classification of bones, gross structure of an adult long bone, blood supply of bones, ossification of long bone, types of cartilage, and clinical anatomy. Skeleton of the body is composed of cartilage and bones. Bones and cartilage are made of specialized connective tissues, which are called as skeletal or sclerous tissue. It forms the main supporting framework of the body. The other functions of the skeleton includes: it provide protection to viscera and provide leverage for the body movement. Skeleton is of two types: axial and appendicular skeleton. To learn more about individual bones of axial and appendicular skeleton, watch a complete video about it. Link is in the description box. Bones are hard structures, which form the rigid framework of the body. Bone is 1/3 connective tissue. It is impregnated with calcium salts, which constitute 2/3 part. It is highly vascular, with a constant turnover of its calcium content. Bones give shape and support to the body, and resist any forms of stress. They provide surface for the attachment of muscles, tendons, ligaments. They contains bone marrow, which is the factory of blood cells. The bones provide protection to the viscera, like the skull vertebral column and thoracic cage protect, brain, spinal cord and thoracic viscera respectively. Bone cells. There are three types of bone cells: osteoblasts, osteocytes, and osteoclasts. Osteoblasts are cuboidal cells arranged in a densely packed layer along the bone surface. They account for 4 to 6% of all bone cells, and their main function is to form new bone tissue. Osteoclasts are large cells whose main function is to dissolve and reabsorb bone tissue. They are found on the surface of bone tissue and originate from white blood cells, monocytes and macrophages. The osteocytes are derived from osteoblasts. Osteocytes account for 90 to 95% of the cells in bone tissue. Like osteoblasts, they do not divide, but they have a long lifespan of up to 25 years. Osteocytes have several important functions in maintaining the mineral composition of bone tissue. Classification of bones. According to the shape, bones are classified into 8 types. Long bones, like humerus, radius, ulnar, femur, tibia and fibula. It also includes miniature long bones, which have only one epiphysis, like metacarpals, metatarsals and phalanges. And modified long bones, which have no medullary cavity like clavicle. Short bones. It includes tarsal and carpal bones. Flat bones. These are shallow plate-like bones. Examples of flat bones includes vault of the skull, ribs, sternum and scapula. Irregular bones. It includes vertebra, hip bone, and bones in the base of the skull. Pneumatic bones. These are certain irregular bones, which contain air-filled cavities within them. Pneumatic bones include maxillar, sphenoid, and ethmoid. Sesamoid bones. These are bony nodules found embedded in the tendons or joint capsules. Examples include patellar and pisiform. Accessory bones. These are not generally present in the body, and sometimes it is confused with fractured bone. Examples include sutural bones. Lateral tubercle of tail is called trigonum, tuberosity of fifth metatarsal, called vacillianum. Heterotopic bones. Bones sometimes develop in soft tissues where they are not normally found. Like horse riders develop bones in adductor muscles, known as riders' bones. Developmental classification of bones. Membranous bones. These are ossify in membrane, and derived from mesenchymal condensations. Examples are bones of the vault of skull, and facial bones. Cartilaginous bones. These are ossify in cartilage, and are derived from preformed cartilaginous models. Examples are bones of limbs, vertebral column and thoracic cage. Membranocartilaginous bones. These ossify partly in membrane and partially in cartilage. Examples include clavicle, mandible, occipital, temporal and sphenoid bone. Somatic bones. Most of the bones are somatic. Visceral bones. These are developed from pharyngeal arches. Examples are hyoid bone, part of mandible and near ossicles. Structural classification of bones. Macroscopically, the architecture of bone may be compact or cancellous. Compact bone is dense in texture, but is extremely porous. It is best developed in the cortex of the long bones. Cancellous or spongy bone. It is open in texture, and is made up of a meshwork of trabeculae. Microscopically, the bone is of 5 types. Lamellar bones. Most of the mature human bones, whether compact or cancellous, are composed of thin plates of bony tissue called lamella. Woven bone. These are seen in fracture repair, and in cancer of bone. Fibrous bone. It is found in young fetal bones, but are common in reptiles and amphibia. Dentine and cement, which occur in teeth. Gross structure of an adult long bone. Naked eye examination of the longitudinal and transverse sections of a long bone shows the following features. Shaft. It is composed of periosteum, cortex and medullary cavity. Periosteum is a thick fibrous membrane covering the surface of the bone. It is made up of an outer fibrous layer, and an inner cellular layer, which is osteogenic in nature. Cortex is made up of a compact bone which gives it the desired strength to withstand all possible mechanical strains. Medullary cavity is filled with red or yellow bone marrow. At birth the marrow is red everywhere, with widespread active hemopoiesis. As the age advances, the red marrow at many places atrophies, and is replaced by yellow, fatty marrow, with no power of hemopoiesis. The two ends of a long bone are made up of cancellous bone, covered with hyaline cartilage. Parts of a young bone. A typical long bone ossifies in 3 parts. Epiphysis. The ends and tips of a bone which ossify from secondary centers are called epiphyses. The epiphysis is of 4 types. Pressure epiphysis. It is covered by an articular cartilage, and takes part in the transmission of body weight, for example head of femur, humerus and lower ends of radius. Traction epiphysis. It is produced by the pull of muscle, for example greater and lesser trochanter of femur. It is non-articular and provide attachment to muscles. It ossifies later than the pressure epiphysis. Atavistic epiphysis. It is an independent bone in lower mammals. In humans it fuses to the nearest bone to get nutrition from the host bone. It grows like a parasite, for example coracoid process of scapula. Aberrant epiphysis. It is an epiphysis, which appears at unusual end of a short long bone. For example, epiphysis at the head of first metacarpal. It should be remembered that normally epiphysis appears at the base of first metacarpal bone. Diaphyses. It is the elongated shaft of a long bone, which ossifies from a primary center. Metaphyses. The epiphyseal ends of a diaphyses are called metaphyses. Each metaphyses is the zone of active growth. Epiphyseal plate of cartilage. It separates epiphysis from metaphyses. Proliferation of cells in this cartilaginous plate is responsible for lengthwise growth of a long bone. After the epiphyseal fusion, the bone can no longer grow in length. Blood supply of bones. The long bone is supplied by 4 sets of arteries. Nutrient artery, periosteal arteries, epiphyseal arteries, and metaphyseal arteries. Nutrient artery. It enters the shaft through the nutrient foramen, runs obliquely through the cortex, and divides into ascending and descending branches in the medullary cavity. The nutrient foramen is directed away from the growing end of the bone. Periosteal arteries. These are especially numerous beneath the muscular and ligamentous attachments. Epiphyseal arteries. These are derived from periarticular vascular arcades, and found on the non-articular bony surface. Metaphyseal arteries. They are derived from the neighboring arteries, and enter the metaphyses directly along the attachment of joint capsule. Blood supply of a vertebrae. In a vertebra, the body is supplied by anterior and posterior vessels, and the vertebral arch, by large vessels entering the bases of transverse processes. Blood supply of a rib. A rib is supplied by the nutrient artery, which enters it just beyond the tubercle, and the periosteal arteries. Ossification of a long bone. Bone ossification occurs in following steps. First, the bone is laid down as a hyaline cartilaginous model, surrounded by perichondrium. A primary center of ossification then appears in the center of the shaft, and spreads towards the ends to form the diaphyses. At the same time, periosteum lays down a collar of bone, around the circumference of the shaft. Then one or more secondary center of ossification develops, at each end of cartilaginous model and form epiphysis. The epiphyseal cartilage separating epiphysis from diaphyses, and articular cartilage at each end of bone remain cartilaginous. The epiphyseal plate of cartilage continues to produce new cartilage, and thus enables the bone to grow in length. Once the growth in length completed, the remaining epiphyseal cartilage ceases to proliferate and become ossified, leaving only a epiphyseal scar called epiphyseal line. Cartilage. Cartilage is a connective tissue composed of chondrocyte cells, and collagen or yellow elastic fibers embedded in a firm gel-like matrix, which is rich in a mucopolysaccharide. It is much more elastic than bone. Types of cartilage. There are three types of cartilages, including hyaline cartilage, fibrocartilage, and elastic cartilage. Hyaline cartilage is located in the articular cartilages of long bones, sternum, ribs, nasal and some laryngeal cartilages. It is bluish-white in color. Fibrocartilage is found in the intervertebral disc of pubic symphyses, temporomandibular joints, and sternoclavicular joint. It is opaque and glistening white in color. Elastic cartilage is found in the pinna, external auditory meatus, eustachian tubes and epiglottis. It is opaque and yellowish in color. Clinical anatomy. Cleidocranial dysostosis. It is a rare defect in membranous ossification. It is characterized by three cardinal features including complete or partial absence of the clavicles, increase in the transverse diameter of cranium, and retardation in fontanelle ossification. It may be hereditary or environmental in origin. Achondroplasia. The defect in endochondral ossification causes a common type of dwarfism called achondroplasia, in which the limbs are short, but the trunk is normal. Osteomyelitis. In typical long bones, infection occurs in the metaphyseal regions, firstly because they have rich blood supply, and secondly because the blood supply in the metaphyses is through end arteries, forming hairpin bends. Therefore the bacteria and emboli are easily trapped in these hairpin bends, leading to the necrosis of the bone. Fracture. It is a break in the continuity of a bone. The fracture which is not connected with the skin wound is known as simple or closed fracture. And the fracture which communicates with the skin wound is known as compound or open fracture. Steps involve in repairing of a fractured bone. When bone is fractured, the blood collects and coagulates, to form fracture hematoma in and around the fracture site. 2 or 3 days later, new blood capillaries and uncommitted cells, from the surrounding tissue invade the hematoma. After 1 week, some of uncommitted cells differentiates into fibroblasts, which produce a fibrous network between fractured ends. The other cells differentiated into chondroblasts, which produce islets of fibrocartilage in the fibrous network, forming a fibrocartilage callus which is known as temporary callus. The osteoprogenitor cells in the periosteum and endosteum around the fracture site proliferate and differentiate into bone-forming cells known as osteoblasts, which invades the temporary callus and lay down the woven bone, which unites the extremities of the fractured bone. It is called as bony callus. The primary bone tissue of the callus is gradually replaced by the mature bone. Remodeling takes place and restore the original structure of the bone. The axis or second cervical vertebra may also get fractured. If dens of axis gets separated from the body, it hits the vital centers in the medulla oblongata, causing instant death. Even fracture of laminae may cause death. Rickets. For proper development of bones, a child requires adequate amounts of proteins, calcium, vitamin D and other minerals. Deficiency of calcium and vitamin D in growing children leads to widening of ends of bones with inadequate ossification. This condition is called as rickets. If deficiency of calcium, vitamin D occurs in adult life, it leads to osteomalacia. In this condition, the bones on X-rays examination do not reveal enough trabeculae. Deficiency of calcium in bones in old age leads to osteoporosis. It is seen both in females and males. Due to osteoporosis, there is forward bending of the vertebral column, leading to kyphosis. In bones, benign or malignant tumors can also occur. For biopsy, bone marrow can be taken either from manubrium steni or iliac crest in various clinical conditions. Hit the subscribe button and press the bell icon.